start the procedure with photography. Then I apply numbing cream on the entire face. I normally use Prilox, and now I will demonstrate skin boosters, how I do it, and skin boosters to improve the quality of the skin. My model here is Winnie, a 49-year-old beautiful woman who wants to improve the quality of her skin, the smoothness, her tone, clarity. She feels that her skin looks patchy. She wants it to look clearer, glowing and more youthful. Now before we start the procedure, you need to assess the skin. Now let us look at her forehead. The skin is a bit rough and pigmented, and when we see her face, there are open pores on the cheeks and a slight pigmentation, and the lateral part of the cheeks has got a pigmented patch. The lips are beautiful, well shaped, but need to be little more hydrated. Her eyelids show a little pigmentation and crepiness. Now we come to her neck. The neck is long and beautiful, but if we see the skin, it is again getting a little lax, and on the sides of her neck, if we see, there is little bit of discoloration or patchy pigmentation, and then there are also horizontal lines. Let us start by showing you how I do the procedure. So when I start, I make a grid or a map on the face. This guides me not to miss any point on the skin. I make a grid on the whole face so that I can be injecting at a distance of 1 centimeter. Some people make a broad grid and some people make a tight grid, and some people do not make a grid at all, but I prefer making a grid on the face because this helps me to cover the entire face in a very even way. Now we see the vasculature of the face. We should not miss that. This is the facial artery going up, giving the angular artery, the dorsal nasal, the superior labial, the inferior labial, and now I am marking the mental artery and its branches. Now this is the inferior orbital artery all along the medial limbus, about 0.8 to 1 centimeter below the supraorbital rim. So it is important to know your vasculature because you have to avoid the vessels, but in skin boosters, since the layer of injection is the deep dermis, the chance of any vascular complications do not really exist. So now we come to the actual procedure where I am going to be using a hyaluronic acid booster. This is actually a solution, a thickish solution of hyaluronic acid, which is injected into the dermal layers of the skin. Now as we see, the needle is very thin. It is normally 30 to 32 gauge, and I inject in micro aliquots into the deep dermis about 0.02 to 0.5 ml at each point. So how I start is that I choose the less sensitive area, that is the sides of the cheeks. So what we do is, important thing is stretch the skin between your two fingers. The angle of injection is about 30 to 45 degrees, and you can even inject 2 points in the same grid. I have already used 0.4 ml. Now I have used 0.7 ml on the cheeks, the chin and the perioral region. So what is the dosage which I am normally using? I use 1 cc on one half of the face, 0.5 cc on the forehead, and 2.5 cc for the full face, that is the forehead, cheeks and chin. On the neck, I normally use 1.5 ml. So coming to the eyes, I am injecting micro aliquots into the deep dermis. I had marked the supraorbital rim initially, and I try to inject beneath the supraorbital rim. I try to avoid going superior to it, very close to the upper eyelid. Now again I have 0.1 ml left. Often people want a little bit of hydration, glossier lips, more redder and pinker lips. So I use skin boosters in the lips. They do not make the lip look larger, but they make the lips look more hydrated and more attractive. We just put a few points into the upper and the lower lips. Now we will be coming to the neck. And important tips to be remembered in the neck is, please do not be superficial. Be either in the deep dermis or in the subdermal region. Again, important is to stretch the neck. Enter at a point of 30 to 45 degrees. And I normally inject 0.75 ml on half of the neck if the neck is long. Flex your neck. As you see, there are horizontal lines which appear on the neck with age, and what you can do is you can just go beneath the horizontal lines and inject a little bit of the HA product. If we see that any part of the neck needs an extra attention, you could give a little bit of extra HA in that area. Like I see, the side of the neck is a bit more rough and pigmented. So I am concentrating a bit more in this area. The neck is now done. I will go back to the forehead area. Normally in a younger patients, you can avoid the forehead as the skin is stretched and tight because of the underlying bone and the young skin. But in her case, I would like to inject the forehead. Again, start from an area which is more sensitive. So I select lateral and superior upper part of the forehead. Now, one thing which we should be mindful of is the vasculature and avoid the vessels, because there is a lot of branchings of the supraorbital and the supratrochlear arteries in this region. Now I am injecting in the sides of the cheeks, and if I feel that there are little globules, I press them down while I am injecting. This not only helps me to get a smoother skin later on, but the patient doesn't complain later. So now I will be doing the chin. Relax, just relax. And I am coming back to the lower eyelid on the other side. We have to be mindful that we are in the deep dermis. We massage the area gently after we inject, and I normally don't go very close to the lower eyelid. I have injected on both the eyelids, and approximately I inject about 2 to 3 ml, 0.2 to 3 ml for the lower eyelids. I have seen in my experience that when I have injected in the lips, it even improves the pinkness of the lips, and patients often come back for the lips again and again. So all in all, I have used 0.5 ml on the forehead and 2 ml on the rest of the face. So now I come back to the neck again on the other side. Now skin boosters help to improve two things in the neck: the crepiness, the hydration, the fine lines, the horizontal lines. It is a good option, especially for a younger neck in the case of anti-aging, where nothing beyond a little improved texture is required. Now as you see, I massage the face with Arnica cream post procedure so as to break and spread the globules if there are any under the skin. This is a very important step because it gives a very smooth appearance and a stretched appearance to the face and helps to disperse the product in a good way. So I always do this and I never miss this step. In the end, we are done with the procedure. We should remember that we should do a repeat photography immediately post procedure and then at a gap of 1 month, 2 months and 3 months.
Hi, my name is Vinny Suri. I've been visiting Alive Wellness since the past many years. I've been getting facial and laser done. Today I got skin boosters done on my face. I experienced an instant glow on my face, a change on my face. Dr. Chhabra and her team makes the treatment very painless. Felt very comfortable during this treatment. I highly recommend this treatment to all age groups. Thank you.
So dear friends, when patients come to our clinic asking to improve their skin, they actually mean skin quality. In my personal experience, I have seen that HA skin boosters give very satisfying results and are relatively longer lasting. Have a great day and enjoy using skin boosters.